Well documented as a botanical medicine for over 5,000 years, the discovery of endogenous cannabinoid receptors and evidence-based reports indicating the efficacy of medical cannabis for treating pain have renewed consideration of its therapeutic use. The past quarter-century's advances in healthcare science has included the discovery of a previously unknown human endocannabinoid system dedicated to maintaining critical balances between our mind and body. The following recording derives from a 6-part series of sequential lectures concerning endocannabinoid receptors and medical cannabis, as narrated by physician expert and author Dr. Jeffrey Block. This publication emphasizes how an appreciation of the biologic context to show how and why endogenous cannabinoid receptors function allows healthcare providers to better interpret the limited evidence-based data. In order to properly assess the abundance of anecdotal reports concerning cannabis, the safe and effective treatment of pain will require careful clinical monitoring of patient outcomes to establish and validate the evolving evidence-based data. Dr. Block is an American board-certified anesthesiologist and respected thought leader with a clinical scientist's understanding of the healing potential found with certain botanical medicines. Fellowship trained in both pain management and addiction medicine, his pragmatic rationale considers a citizen patient's compassionate access to the cannabis plant's bioactive chemicals when used for the treatment of pain, as well as acknowledging cannabis's obvious public health concerns ranging from contaminants to dependence. The author's insight shares contemporary perspectives by first acknowledging the bioethical obligation healers have to not simply feel compassion for their patients, but to strive to effectively treat pain. This is emphasized while at the same time acknowledging those concerns to public health surrounding addiction and accidental overdose deaths. Dr. Block's writing reveals how and why a human being's natural instinct nurtures their nature through their body's own endocannabinoids, and why a contemporary physician healer's understanding of the traditional ethnobotanical role certain plant-based medicines have played in treating the intolerable symptoms of disease appears to have also tangible value in modern healthcare. As read from Endocannabinoid Receptors and Medical Cannabis, here is the author Dr. Jeffrey Block's narration of Section 4, Research and Education.
Evidence-based data advances anecdotal reports. The evidence in support of cannabinoids as a treatment for acute inflammatory and neuropathic pain includes preclinical laboratory and animal studies, as well as experimental and clinical trials with humans. Though research has been limited by the constraints of drug scheduling and other administrative barriers, there is considerably more evidence for the efficacy of cannabinoids in the treatment of pain than for any other application. That evidence has been well summarized by a pair of commissioned federal reviews, first in the 1999 report of the Institutes of Medicine, and then in the 2017 report of the National Academies of Sciences, Engineering, and Medicine. The 1999 Institutes of Medicine report. Only 7 years after the discovery of the endocannabinoid system, the Institutes of Medicine report noted that cannabinoids likely have a natural role in pain modulation, a conclusion that has been further developed and supported by basic research, and that cannabinoid drugs hold particular therapeutic promise for pain relief. The authors acknowledge that pain is the most common symptom for which patients seek treatment, and research findings on the analgesic properties of cannabinoids are consistent with anecdotal reports on how cannabis appears to modulate pain. Animal models of acute inflammatory and neuropathic pain have all responded positively to cannabinoid receptor delta-9 THC agonists, and the patient groups the report identifies as most likely to benefit from cannabinoid medicines are cancer patients being treated with chemotherapy, postoperative pain patients, particularly those experiencing nausea or vomiting from opioids, patients with spinal cord injury, peripheral neuropathic pain or central post-stroke pain, chronic pain patients with insomnia, and AIDS patients with cachexia, neuropathy, and other significant pain syndromes. This suggests that cannabinoids may be useful and indicated for a variety of reasons, including its synergism with other analgesics, for patients who have developed a critical tolerance or intolerance to opioids, for conditions in which cannabinoids may be safer than other medications, for situations in which certain side effects may have clinical usefulness, and for an apparent efficacy helping treat a remarkably broad spectrum of illnesses. Pain management experts consider neuropathic pain to be among the most challenging of pain syndromes to treat. The Institutes of Medicine report points to the treatment of neuropathic pain with cannabinoids as particularly promising based on experiments treating rodent models of neuropathic pain with cannabinoids capable of helping treat two problematic types of increased pain sensitivity, allodynia and hyperalgesia, associated with neural changes resulting from chronic pain. Cannabinoids showed potency and efficacy comparable to opioids in those experiments, and the Institutes of Medicine also notes the efficacy of THC shown in 3 studies of treating severe cancer pain resistant to opioid treatment. Those conclusions are borne out by subsequent clinical research addressed in a 2017 comprehensive report from the National Academies of Sciences, Engineering, and Medicine. That National Academies report reflects a consensus conclusion of graded critical meta-analyses of the 24,000 relevant scientific publications on cannabinoids since the time of the Institute of Medicine report in 1999. Of all of those publications, 100 studies were selected as meeting the clinical criteria. Evaluation of these study results produced a consensus conclusion that there is substantial evidence that cannabis is an effective treatment for chronic pain in adults. Their report focused on 5 systematic reviews of clinical studies using cannabinoid medicines. For chronic pain, they relied primarily on one extensive review that included 28 randomized clinical trials on treating pain involving 2,454 participants that compared cannabinoid treatment to placebo, and another that compared cannabinoid medicine to amitriptyline for neuropathy. Plant-derived cannabinoids of various types were used in 22 trials, while a synthetic analog of THC, nabilone, was used in 5. Neuropathy was the focus in 17 of those trials. Other pain studies included cancer and chemotherapy-induced pain, multiple sclerosis, rheumatoid arthritis, and musculoskeletal pain. Plant-based treatments were approximately 40% more likely than controls to produce significant analgesia across all pain conditions. Inhalation was the route of administration in just one of the studies included in the review, but the National Academies authors note that its results were both comparable with other routes and consistent with a different review of 5 other trials of inhaled cannabis in the treatment of neuropathic pain. As previously emphasized, the results of these and other controlled human trials are consistent with more voluminous anecdotal patient reports, experimental animal studies, and laboratory research, all of which point to the utility of cannabinoid medicines as analgesics. Systematic reviews of clinical studies of treating animals with cannabinoids, whether whole plant products, isolate extracts, or synthetic analogs, found the study conclusions were largely consistent in showing that cannabinoids demonstrate a modest effect on pain, regardless of type of cannabinoid or type of pain, including arthritis, spinal cord injury, and neuropathy. The distress associated with neuropathic pain is a particularly challenging condition to treat. Another systematic review coordinated by the United States Department of Veterans Affairs concluded that limited evidence suggests that cannabis may alleviate neuropathic pain in some patients, but insufficient evidence exists for other types of chronic pain. Multiple sclerosis, or MS, is another often painful condition for which the National Academy found substantial evidence of cannabinoid medicines being efficacious. Most randomized clinical trials of cannabinoid medicines in the treatment of MS have evaluated the effects on muscle spasticity, a condition that impairs function in 90% of these patients at some point during their illness. A more recent review of randomized multiple sclerosis trials also found that cannabinoids, including smoked cannabis, are superior to placebo in relief of pain and spasticity. Both subjective patient reports and objective clinical measures of spasticity indicate some efficacy, but subjective reports of effect are consistently greater than objective measures. This disparity has led some to suggest that the clinical measures are flawed by limitations in design, and others to speculate that the euphoric side effects of cannabinoids are distracting patients from painful spasticity sufficiently to produce reports of improvement without significant change in muscle tone. MS patients may experience other symptom improvements with cannabinoid medicines, such as reductions in anxiety and depression, that may contribute to the differences between subjective reporting and objective clinical assessments. For the 100 million persons with chronic pain in the United States, second only to lower back pain is severe headache and/or neck pain. The National Academies report does not address cannabinoid treatment for migraine and other headaches, as clinical trials are lacking. But many migraine sufferers report using cannabis, often prophylactically in low doses. Growing understanding of the neurological and vascular mechanisms of migraines indicates involvement of the endocannabinoid system affecting the serotonin and endorphin receptors on which it operates, suggesting that exogenous cannabinoids may not just have a role in treatment, but provide an ideal medication. A recent review of preclinical studies and clinical trials identifies historical reports from the 19th and early 20th century that cannabis preparations were effective in both aborting and preventing headaches, as well as several modern case reports and patient surveys that found the same. But the lack of clinical trials means evidence for cannabinoid treatment of migraines and other headaches is inconclusive. Migraine headache disease-targeted therapy suggests that cannabis breeding for cultivar-specific synergistic ratios of cannabinoids, terpenes, and other phytochemicals may result in predictable user effects to improve symptoms. The multiple effects of cannabinoid medicines are not available a la carte. For many patients, the inseparable broad-spectrum effects can be a benefit because one medication may provide multiple mechanisms of therapeutic actions. For many pain conditions, anti-inflammatory and analgesic effects are both helpful. For chronic pain, psychosocial symptoms such as depression and anxiety often also require concurrent interventions, such that the euphoric side effects of cannabinoid medicines may be effective in treating those symptoms as well. Clinical rationale to cannabinoids used as medicine. A concept model describing the roles of endocannabinoids. The components of the endocannabinoid system are expressed in nearly all parts of the human body throughout every stage of life. Upon conception and continuing until death, the actions of messages that are produced by endocannabinoids, alone or in combination with other mediators, support all basic life-sustaining functions. From the perspective that all animals' genetic ability to evolve relies on maintaining an effective balance with life's continuous stressors, a healthy animal's naturalized response requires an effective endocannabinoid system's nurturing to ensure its ultimate survival. As an educational concept model, the endocannabinoid receptor's clinical roles can be regarded as constantly integrating the balance of 5 general functions that are collectively essential to sustaining life. This receptor system's general purpose is in supporting the abilities to eat, sleep, relax, forget, and to protect from the consequences of disease as age advances. Growth and development's dependence on balanced eating and sleeping is obvious and is a critical role of CB1 receptor function. Understanding endocannabinoid system-wide function even explains the holistic and scientifically elusive so-called brain-gut connection. The ability to recover from life's relentless physical and psychological stress is directed through endocannabinoids. This recovery requires not only time to physically relax and recover, but also the ability to forget. Effective processing of new memories occurs in the brain's hippocampus, which is replete with CB1 receptors. The filtering of memories through effective CB1 receptor function is a genetically hardwired protective mechanism essential for behavioral health. Along with the brain's amygdala, intolerably painful physical, psychological, or spiritual experiences are selectively filtered through these parts of the brain, and pathologic inabilities to forget intolerable situations can lead to pain sensitivity and avoidance behaviors such as are seen in patients suffering from post-traumatic stress disorders or PTSD. Conversely, the astute clinician may also observe that when a patient's inability to forget a pleasurable experience leads to their inability to control seeking that circumstance, then such pleasure-seeking behavior may cause the patient to suffer from the consequences of an addiction's dependency. As life's experiences accrue, the endocannabinoid system's effect on selectively filtering painful and pleasurable experiences may be a critical determinant in the development of one's behavioral personality. Because so little is known about the biochemical basis of personality, it is intriguing to consider that the endocannabinoid system's contributions to functional health might be central to the understanding of this elusive human characteristic. In contrast, CB2 receptor functions play a particularly important protective role by mitigating the physiologic consequences of disease. CB2 receptors are generally thought of as being plentiful in the abdomen in proximity to where the majority of cells of immune lineage are known to exist, but are cellularly ubiquitous in that they have been identified not only in vascular cells, but also in adipocytes, B lymphocytes, and macrophages. CB2 receptors are primarily associated with cells of innate immune lineage derived from the bone marrow. In the central nervous system, CB2 receptor expression is associated with responses to injury by modulating inflammation. CB2 receptors help maintain pivotal balances that are able to respond when and where an organism is threatened by the effects of disease or injury. In a clinical sense, corrective physiologic changes modulated through CB2 receptors may be those which allow a disease to become chronic, when an inability to respond to the progression of disease over time would otherwise result in death. This possibility emphasizes the clinical importance of future innovations that exploit this receptor system's subtle yet essential health function. One of the few places where cannabinoid receptors are not found is within the portion of the brainstem's medulla and pons devoted to respiration. This neuroanatomical advantage helps explain cannabis's lethal dose safety profile. Even with its abuse, no respiratory depression fatal overdoses attributed only to cannabis have ever been documented. Experimental safety challenges in reliable animal models include studies in which monkeys and dogs were administered extraordinarily large doses of THC, equivalent to a human being consuming 63,000 times a standard 10 milligram dose without lethal injury from central respiratory depression. Complicating this picture of cannabinoid receptor modulation, activation, and deactivation are compounds recently described as superagonists, synthetic compounds that bind to cannabinoid receptors much more intensely and overdrive their response. Superagonist chemicals with street names such as K2 and Spice are misleadingly referred to as synthetic marijuana, but were originally developed as experimental laboratory molecules never intended for human use. These synthetic cannabinoid analog products are not infrequently abused by school-age youth and can pose substantial dangers, including death. The substances are not chemically similar to THC or other phytocannabinoids, but can strongly bind to cannabinoid receptors, exerting up to 100 times more effect. The use of synthetic superagonists may result in serious injury or death because sometimes these drugs are manufactured in combination with potentiating chemicals thought to prolong their intoxicating effects, such as anticoagulants including warfarin as found in rat poison. In contrast, excessive doses of cannabis, typically in the form of edible products whose potency is often discovered too late, can cause acute discomfort manifested as paranoia and dysphoria in individuals that may lead to emergency room visits after ingestion, but physical or psychological injury does not result. Cannabinoids, both endogenous ligands and exogenous molecules, plant-derived or synthetic, produce a wide range of receptor activity consistent with their role as modulators of bodily functions. A crucial difference between endogenous and exogenous cannabinoids is the locations they affect and their duration of action. While endocannabinoids are produced on-site and on demand and are created and degraded very rapidly, exogenous plant-based and synthetic cannabinoids typically produce system-wide effects that persist far longer.
This recording has been a healthcare educational initiative read by physician-author Dr. Jeffrey Block. Dr. Block is the founder of Nurturing Nature Group Consultants, an independent and scrupulously neutral interdisciplinary consultancy group advancing endocannabinoid science through translational research within the practice of integrative medicine. To learn more, please visit nurturingnature.com.